Now, if we take biofilms and we layer on the current events of COVID with it, there's research suggesting that COVID biofilms could be at play in the mouth, okay? And since it's an upper respiratory infection, researchers have investigated whether mouth rinses could be effective in helping decrease viral load and risk of infection. So here's a study from the Journal of Clinical Medicine, came out recently, April, and it said, the oral cavity is considered a major portal of entry for infectious agents and is directly associated with the evolutionary process of SARS-CoV-2 in its inhalation of ambient particles in the air and expectorations. So basically, SARS, the saying is that SARS is spread through coughs and air droplets, right? And so how are we inhaling those? Well, through the mouth and through the nose. So the mouth could be a major portal of entry. Some new generations of mouth rinses currently on the market have ingredients that could contribute to lower the SARS-CoV-2 viral load. And SARS-CoV-2 is what causes COVID, right? So if we have mouthwashes that can lower the SARS-CoV-2 load, that would decrease risk of COVID infection. So these authors were saying, if we can figure out a product that combines the mouthwash that's effective against it plus antioxidants that's effective against COVID, then that would be a valuable adjunct to treatment to decrease viral load in the mouth and nasopharynx and prevent infection and spreading. So I thought that was pretty cool. If we go to another study, here's a medical hypothesis recently, and these authors were talking about periodontal pockets. So in your mouth, around the teeth, you have periodontal pockets, and in those pockets, periodontitis can develop, or inflammation, okay? And inflammation of the periodontal pocket is the area around the tooth, or the teeth supporting tissues. This is very prevalent in adults, okay? So if you have bad breath, that could be periodontitis. If you floss or brush your teeth and you bleed, that could be periodontitis. It could be gingivitis as well. So these authors say periodontal pockets are ideal environments for subgingival bacterial biofilms that interact with subgingival oral or supragingival oral cavity. So it interacts with the mouth as we know it up here. Also mucosal tissues of the pocket and the peripheral circulatory system. So anything going on in the periodontal pocket could impact the mouth as we know it, like up top, right? The mucosal tissues of the mouth in the pocket and the circulatory system peripherally, because you can enter the blood through the mouth, right? We've all heard about the connection between, say, gingivitis and heart disease, right? Because it enters the gums. Just like we hear about leaky gut, there's also leaky gums, right? And that's a way into the body. So leaky gums or periodontal pockets have also been shown to be a harbor for viruses. Herpes simplex viruses have been found in these pockets. So these authors hypothesize that, hey, a periodontal pocket could be a favorable niche for SARS-CoV-2 as well. And so it's not proven yet, but they lay out their argument for it. And one of the big arguments is that, I don't know how much you've been reading on this, but the Ace2 receptor is the main receptor in the research that the virus uses to enter our cells, okay? And these authors say the Ace2 receptor, besides being found on the lungs and the nasopharynx and the salivary glands, are also being found highly in the oral cavity and the oral epithelial cells. They've also found Ace2 expression in the gingival and periodontal ligament fibroblasts, so the cells that are making the ligaments holding our teeth in place. And then they also cite research that recently found a different infectious route by SARS-CoV-2, which is by using its spike protein to bind to white blood cells that are CD147 positive.